Hello and welcome. So today I'm going to talk about mainly two topics of these special videos. First of all, spaces of back and our axilla. Now, both topics are very important for your theory exam, viva exam, practical exam, also in MCQ based exams. Okay. First of all, I'm going to talk about our spaces in back. Now, there is mainly two types of space. One is quadrangular and another is triangular. Triangular is divided into two subtypes. One is upper triangular, lower triangular. Now, first of all, I'm going to talk about quadrangular space as you can see in this photo. Now, what you can see, first of all, you have to know that the space is mainly in between teres major muscle and teres minor muscle. Okay. Now, by the name of this teres major and minor, you already have idea that this area presents in the lateral border of the scapula. Okay. You have to know about that the boundaries. First of all, superiorly or the superior boundary is formed by the subscapularis muscle, then capsule of the shoulder joint, then inferior border of the teres minor muscle, mainly a little bit posteriorly. That's it. Inferiorly, it is formed by the superior border of the teres major muscle. Laterally, you're going to find surgical head of the humerus. What is the surgical head? I already talked about this surgical head, anatomical head of the humerus in bone parts. Okay, you can check those videos. Now, the medially you're going to find especially the long head of the triceps. Specifically lateral border of the long head of the triceps muscle. This is the triceps muscle. Okay. Now, what is the content? What are the structure presents in between this space? Mainly the axillary artery and the posterior circumflex humeral artery. Okay. Now, triangular spaces, as I said, triangular spaces, two subtypes. One is upper triangular and lower triangular. First of all, upper triangular space, you're going to find the space again in between the teres major and teres minor muscle. But you have to know the boundary. The boundary is mainly formed by the superiorly, you're going to find inferior border of the teres minor muscle, and inferiorly, you're going to find superior border of the teres major muscle. And medially, you're going to find long head of the triceps. Only one content, circumflex scapular artery. That's it. Lower triangular space. This lower triangular space is bounded by the medially lateral border of the long head of the triceps, then laterally medial border of the humerus, and superiorly it is bounded by the inferior border of the teres major muscle. Okay. Now, what are the contents? Contents are mainly you're going to find two contents. First of all, radial nerve and profunda brachii vessels. Now, coming back to the axilla, which is very important. As you can see in this photo, axilla, this area, it is actually pyramidal shaped space in between our upper part of the arm and the upper part of the lateral thoracic wall. Okay, it has apex, it has base and forewall. Okay, anterior, posterior, medial, lateral. Now, first of all, talk about apex. Apex is blunt and directed upward and a little bit medially in the roof of the neck. Apex part is also known as cervicoaxillary canal. It is bounded by the anteriorly clavicle, posteriorly the superior border of the scapula, and medially by the outer border of the first rib. Okay, whatever I am saying in the right side also same to same presence in the left side also. Okay. Now, you have to know about the contents of the apex part of the axilla. What are the contents? Contents is mainly the axillary vessels and the cords of brachial plexus. Axillary vessels means axillary vein, axillary artery, along with the brachial plexus. Few cords. What is brachial plexus? What are the cords? What are the parts of brachial plexus? I talked about in my old videos of nerve anatomy. You can check that. Now, the base is actually concave shaped. Okay, it is bounded by the anteriorly and posteriorly axillary folds. Okay, both sides, anteriorly axillary fold, posteriorly axillary fold, and medially chest wall. It is formed by the skin and subcutaneous fat tissues along with the axillary fascia. Okay. Now, one extra knowledge point for you. You have to remember that this, as I said, anterior axillary fold and the posterior axillary fold. The anterior axillary fold is formed by the extended part of the pectoralis major muscle. Okay, and the posterior axillary fold is formed by the latissimus dorsi muscle and the extended part of the teres major muscle. That's it. Anterior wall of the axilla is formed by the, first of all, pectoralis major muscle. Then you're going to find pectoralis minor muscle, and then you're gonna find subclavius muscle, clavipectoral fascia, and the suspensor ligament of axilla. Okay, and the posterior wall is formed by the common sense latissimus dorsi muscle, teres major muscle, along with the subscapularis muscle. That's it. The medial wall, I mean the the chest wall, it is formed by the upper 4 to 5 ribs. Okay, along with the intercostal components, I mean the intercostal muscle, intercostal artery, intercostal vein, intercostal nerve, intercostal lymphatic nodes. Okay, along with the long thoracic nerve and upper part of the serratus anterior muscle. Okay, and the lateral wall, which is in the upper part of the arm, it is formed by the shaft of the humerus, which is the intertubercular sulcus, which contains long head of biceps muscle. This is the biceps muscle. Okay, and you're gonna find short head of biceps, very small part, and coracobrachialis muscle. That's it. These are the boundary of the axilla. Now you have to know what are the components of the axilla. First of all, you're going to find axillary component, I mean the axillary vessels. First of all, axillary artery and its branches, axillary vein and its tributaries, axillary lymphatic nodes and its tributaries. Okay. Also, you're going to find cord portion of the brachial plexus and the branches of the brachial plexus, mainly the long thoracic nerve and intercostobrachial nerve. Two things mainly, it is covered by axillary fat, and in my previous video I told you that axillary tail of Spence, which is a continuation part of the body of the breast. Okay, see you soon with our next part of the video. Till then, bye.